How does CORT scan differentiate diverticulitis versus appendicitis? When it comes to abdominal pain, figuring out whether it's diverticulitis or appendicitis can be tricky because they share some symptoms like pain and tenderness. But doctors relying heavily on imaging, especially computed tomography scans, to tell them apart. A CORT scan provides detailed pictures of the inside of your abdomen, helping identify exactly where the inflammation is and what structures are involved. In diverticulitis, the inflammation usually involves the colon, most often the sigmoid colon or sometimes the right side of the colon. On a CORT scan, this appears as thickening of the colon while along with surrounding fat stranding, which is inflammation of the fat tissue around the colon. These inflamed areas often show small pouches called diverticula, which are outpouchings of the colon wall. Sometimes, an abscess or localized fluid collection can be seen near these diverticula, indicating infection or inflammation. In contrast, appendicitis shows inflammation confined to the appendix, a narrow tube that extends from the cecum in the right lower part of the abdomen. On a CORT scan, the appendix appears as a dilated, thick-walled, inflamed tubular structure. It often contains fluid inside, which can be seen as a fluid level, and may have an appendicolith, which is a small calcified deposit blocking the appendix. The surrounding fat tissue also shows stranding, but the key is that the inflammation is localized to the appendix itself, not the colon. Another important difference is the presence of diverticula. In diverticulitis, you can see small outpouchings of the colon wall, which are inflamed. These diverticula are not seen in appendicitis. Conversely, in rare cases of appendiceal diverticulitis, small cystic outpouchings from the appendix wall may be visible, but they usually don't have the same fluid collection or appendicolith typical of appendicitis. The overall pattern on the CORT scan helps doctors distinguish between the two. If the scan shows inflammation centered on the colon with diverticula and no clear signs of an inflamed appendix, it points to diverticulitis. If the inflammation is localized to the appendix with a dilated, thickened tube, fluid, and possibly an appendicolith, it indicates appendicitis. This distinction is crucial because diverticulitis is often managed with antibiotics and supportive care, while appendicitis usually requires surgical removal of the appendix. While clinical symptoms and lab tests like elevated C-reactive protein support the diagnosis, the CORT scan provides the definitive picture. Its high sensitivity and specificity make it a reliable tool for differentiating these conditions, especially in complicated cases. However, sometimes the findings can overlap, especially in cases of inflamed diverticula in the appendix, which can mimic appendicitis. That's why a detailed scan, read by experienced radiologists, is essential. In summary, a CORT scan helps differentiate diverticulitis from appendicitis by showing inflammation in the colon with diverticula and no signs of an inflamed appendix, versus inflammation confined to the appendix with typical features like fluid and an appendicolith. Accurate diagnosis guides appropriate treatment, helping avoid unnecessary surgery or delayed care. Always remember to consult a healthcare professional for personalized diagnosis and treatment options.